Hey guys, Eric, your coach here. So excited to have you back. And so obviously you've emailed me for some support, and Eric, your coach at charter.net is that email address. Obviously, if you go to victorydentalconsulting.com, you can follow me on Facebook and Instagram and see pointers there as well. I want to start with you guys because I want to do some follow-ups before we jump into today's meeting. So you could pause this if you want, especially if you pause it in a perfect place where my face is doing a really weird, contortion, then that would be really funny for you guys. So hopefully you enjoy asking for referrals, and you're doing a really good job at it. So you can email me. I'd love to hear your success story with it. You ask for referral, you're handing out your referral cards, or you ask for review and you're handing out your postcards. If you haven't already, I want you to have emailed me and requested the either one of those for example so that you can make your own. Your leaders for huddle and asking for referrals should be keeping us all accountable to this, making sure that we're doing it doesn't fall to the wayside. We're going to keep adding to our plate, so we want to make sure we have leadership in place. This should also be getting you thinking about your 12-month marketing plan. Do you have one? Are you doing something every other month to just engage potential new patients, whether that's paid marketing, like we talked about, one of the pillars, or whether that's going out and doing a health fair. So email me questions, email me challenges. I have a 12-month marketing plan example. I can give you templates so that you can walk through it. So be in contact with me. Okay. I also want to hear your challenges. So every month, have a 3x5 card, have your phone ready to take a note and say, Eric on it, and just say challenges. And then you can email me those challenges. I can respond. We can converse that way as well. So with coaching anytime online, you're doing this at a time that works for you. And that probably means I'm on the phone with another client, or we're in a different time zone. And so emailing is a great way for us to stay in touch. Sound good? All right. So let's jump into meeting two. This is approval addiction, overcoming your fear of rejection. And so every single one of our systems, right? Every single one of our systems or verbal skill systems has a way to approach this that makes it easy for you. So remember, you're the dentist, you're the dental office, you're the clinicians, that's your expertise. That's how you get people healthy, right? That's 15%. I'm going to spend the time on the 85%, the people skills. So this was the preview I showed you last time that we were going to go through. And so let's take a look at this overview of the 4-step action plan of beating approval addiction and overcoming your fear of rejection. All right. So number one, we're going to talk about your confidence level. So are you confident in your ability to communicate with your patients, with potential patients, with your team? Number two, we're going to talk about how we handle this together as a team. And so we'll get into this, how we encourage one another. Number three, we're going to get into a verbal skill. Okay. The permission statement. If you're not already using this is a no-brainer. This is a simple way to help not only overcome your fears, but also the patient's fears of being pressured into a sale. And number four, my favorite verbal skill training of all time, eliminating limiting terms. We'll talk about what those are in the categories, and we'll even create a list on how to make sure we avoid those. All right, let's get started. So what does fear of rejection look like? Well, you feel guilty for having to diagnose and tell people how much it's going to cost, or you're apologizing for the existing condition. I'm so sorry. You're saying things like, we have an infection, right? That fear of being shot as a messenger prevents you from actually giving the message. And limiting terms, maybes, just kind of, there's a little, we'll talk about these. Even talking patients out of treatment. I see it all the time where, we've heard, offices will tell me, or I'll observe in their practice when I'm on site, and I'll hear them say, they've got the patient to a certain level of moving forward, and then they keep talking and keep talking. And the next thing you know, the patient's not going to move forward. Okay. Diagnosing the patient's wallet. I think in any given moment, we've all been guilty of this at some point in our lives, where we judge a book by its cover. We look at them and we say, gosh, we better, talk to them about a partial here instead of talking to them about implants or a bridge or something like that. Okay. just being burnt out when it comes to communicating with patients because that rejection has just constantly been happening. And so I want to help just rejuvenate you and get you fired up again about talking with patients in a way that makes sense. And when we don't have leadership, everyone's going to lead something. So all of you are going to be leaders. So when we don't have leadership in these areas, things tend to fizzle and we give up. Okay. So I've seen there's three possible scenarios here where the patients run the office, and it's like that, the scales, right? The scales of the judicial system where the lady's blindfolded, she's got the scales, and one's weighing the other down. Either the patients are running the office and the office is bending over backwards. They show up when they want, they don't pay their bills, they say, send me a bill. They tell you they want a discount, whatever it may be. Or it's reversed. You've got to prepay. We only see you at this time. There's lots of limitations, a lot of hoops to jump through for the patients. And what we're trying to do is just balance that out, make it a win-win for both. And so we can get the patient happy and you overcoming your fear of rejection. So, what's our barriers? What is the number one barrier to success? Now, remember, I talked about success comes from people skills. So, what's the number one barrier to creating success when it comes to those verbal skills? And so, we're talking about it today. This is exactly what we're talking about. Everybody can throw out a guess if you want. There's no wrong answers here. So, what's the number one barrier to success you think in your mind? Here's what my experience shows me in majority of the time is that this approval addiction or fear of rejection and low self-esteem create doubt in our mind. We limit ourselves in what we present. The patient picks up on it. And the simple example would be if you went with your family member, maybe a grandparent or a parent, and you took them to the heart doctor, even the surgeon, and you're sitting across the desk getting a consultation from this heart surgeon because your family member was in need of this type of service. And you started to pick up on some things that you didn't really feel like made this doctor confident in either their diagnosis or their ability to deliver the solution. If that happens, you start to waver. You go for a second opinion. You move on to someone else. I had to have some testing done a couple years ago, and one of my nursing friends couldn't believe I was going to this facility, but it was where my physician had referred me to. And she was like, no, you've got to go, out of town to this area. And you got to go over here to have this sort of testing done because they know what they're doing. I don't have faith in them. And so other people, word gets around. If other people are picking up on this, they're going to talk about it as well. We talked about last month. You've got Yelp and Google reviews out there. So there's a lot of things repercussions that can occur if you don't have that confident ability to deliver your message. So this is what we're going to talk about today, how to overcome this as a team. So where does self-esteem come from? What do you think about it for a second? Even write it down. Where do you get your self-esteem? How do you get this? Where does it come from? Now, when I'm doing team case acceptance training in front of a group of, say, I don't know, a few offices, 100 people, whatever it is, and I ask this question, and I get hands raised. I ask them, so where does self-esteem come from? I typically hear a variation of two responses. Number one would be perception of others. How do people see me? The judgment I receive as I grow up as a kid, right? Perception of others. And the other one I hear is performance-based. How well do I perform? Whether it could be growing up with sports, whether it could be grades, whether it could be behavior in the classroom. And even now, it can affect your self-esteem that way. People saying something about your performance. Okay. Now, based upon my experience, I think people really believe those two things help create your self-esteem. And what I'm here to tell you guys is that is false. That there is no way that your self-esteem should be based upon what other people think of you or your performance. Nobody is perfect. Nobody's going to have a perfect performance all of the time. That's impossible. So mistakes will happen. Remember we talked about celebrate your mistakes, right? We're going to talk, how do you celebrate your mistakes? We're going to talk about that today. So that's something that we have to do. So if those aren't the real definition of self-esteem, what is it? Well, look at the word self-esteem. Where does self-esteem come from? Where does your internal confidence come from? Look at the word. What do you think? That's right, yourself. Absolutely, yourself. What you tell yourself is what you're going to believe about yourself. So if somebody is, as a child, right, if somebody's picking on you, making fun of you, saying something, and you choose to believe that instead of oppose it or fight it back, then it's going to become a part of you. And that self-esteem will take a hit and take a hit and take a hit, and you are allowing that to happen. Self-esteem is a choice. It's a choice that you make. One of the number one fears for people is public speaking. That's a fear that's real. Now, me having that fear early on, back in the early 2000s, I had to overcome that fear. And so it was, what did I tell myself? That self-talk that I plugged into my own mind, right? What did I tell myself about who I was and who I wanted to be? Was I going to believe childhood bullying or whatever it is, or fear of what people might think of my performance up there? Or was I saying to myself, hey, I got to go up here and communicate something that I really believe in to help others? And so each day we got to figure out how to plug into that, how to make that a choice. And so we give it a system. We give it a number. We give it a 10. And so the 10 is my confidence level. What is my confidence level, and how do I project that? Here, you're going to hear me say this a lot, guys, especially when we get into, preventing cancellations. But we teach people how to treat us. You should write that down. We teach people how to treat us. This is true in your personal life. This is true in your professional life. It just is. And so how do we make ourselves a 10? That has nothing to do with my physical appearance. There's, people talk about beautiful people. They're the 10s, that whole, Bo Derek thing. That has nothing to do with this. This is our ability to live life and interact with other people and deliver a service and be a friend. That's what this is about. When you're talking about the perfect 10 physical beauty stuff, they make mistakes all the time too, whether it's, intellectually or communication skills, whatever. Outside appearance does not determine a 10. As well as your inside, your outside can match. You can deliver that. So if your inside is saying I'm a 10, your body language is going to communicate that. Right? 93% of communication is nonverbal. So that means how we carry ourselves, not just the words we use, are really important. So what are you projecting? So how do you project your 10? Remember, this isn't being perfect. So take a minute, write down on a piece of paper, write down, your imaginary pen on your hand. You can put it up here and project it if you like, but people are treating you the way you're projecting. You're telling them how to treat you. And if it's a choice, if I get to choose what my confidence level is, not arrogance, not cockiness, but my confidence level, then I'm going to choose to be a 10. I'm not going to choose to be a 9, an 8, a 7, because I'm like, well, 10, that's too much. I'm not going to do that. I don't want to be that person. That's a mistake. That's a mistake. And if you have something that's preventing you from believing that you can be a 10, that you deserve to be a 10, then there's something to work on. I do life coaching all the time with people. And one of the things we talk about is, hey, what circumstances are you dealing with in your life, and how is that caused, or how has that affected your confidence level? Because until you're confident at 10, you can't get the results of a 10. That makes sense? So I want you to write down that you're a 10. Start to tell yourself, your self-talk. Start to tell yourself, I'm a 10. All right? Now, we're going to define what this looks like. We're going to define this right now. We're going to do an exercise together. So being a 10, being confident, what does this look like? We're going to write down some descriptive terms on how that is in your office. This is professionally. So start right now. You can push the pause button if you like. I'm going to call out some things here in a moment just to get you going, and then you can push the pause button. I'm going to give you 3 or 4 ideas, and then you get going. Okay, you push the pause button. And you're going to write down some terms. that you think describe being a 10? So, like confident, what sort of facial expressions are people making when they're a 10? How do they carry themselves? What's their attire like? And then how do they behave, right? As they walk into a room, good posture, all of those sorts of things. Okay. So I want you to push the pause button and then I'll come back with some other ideas. Go for it. All right. So hopefully you wrote down things like eye contact, smiling, good posture, dress professionally, whether that's business attire, administratively, or your clinical attire, all matching, hair, whether that's makeup or not, right? Looking the part, okay? And then carrying yourself, things like a positive person, someone who's engaging, who asks questions, who's interested, not interesting, somebody who's coachable and approachable, somebody who treats others like a 10. So write all of these things down, create a board, a poster that you can put up where you have your morning huddle so that every day you walk in and you see this 10 in the middle with all these words and you say, who am I being today? We're going to be talking a lot about adaptive behavior, adaptive behavior. It's something that we have to adjust to because we are filling a role. When you talk to somebody on the phone and they have really high customer service, right before that, it said, this call may be monitored for quality assurance. And then you get on the phone with them. I promise you, they don't talk like that 24/7. That's adaptive behavior. They've adapted to fit that role. We're asking the same thing of ourselves here in the dental office, right? In your place of business, you go in and you behave as though you are a 10. That means you fit this role. Now we have to do it, right? Look, we know better, right? Knowledge is power. You've heard that saying before, knowledge is power. Is that true? Everybody say, is it true? Yes or no? What do you think? Knowledge is power. Yes or no? Everybody call it out. Look, I'd say knowledge is power with an asterisk on it. I don't know. Knowledge is power. Like, if just because you know something, do you really do it? It's the action that creates the power. So knowledge is power when you put in action. Without the action, knowledge is powerless. And so now that you know, hey, it's my choice to be a 10. These are the behaviors. This is how I'm going to carry myself. Now it's your choice to create the action to do it. And so we'll create leaders at the end of this to help us stay accountable to being a 10 and so on. So have your poster, get it up on the wall so at morning meeting you're seeing that, okay? Don't take work home. Don't bring home into work. Carry yourself in a way of confidence, okay? So being confident in your delivery is huge when it comes to overcoming fear of rejection, approval addiction. It also helps with case acceptance because people only want to work with people they believe know what they're doing. We call it confidence in your competence. Write that down. Confidence in your competence. Are you creating an environment and a culture and carrying yourself in a way that allows people to see that in you? All right, our 4-step action plan number 2, our team. Look, guys, we are a team. We may be friends, but we are a team. And when we're performing in this place of business, our culture is to improve one another, to lift each other up, and to treat each other like a 10, to exalt the other person. In fact, we're going to treat each other like eagles. That's the vision that I want you to have. That's what I want you to see. So what does that look like? How do you do that? Well, a team, right? Together, everyone achieves more. That's what that acronym is for. That's why we do that. So together, we're going to do these things. And so coaching each other is a couple things it's not. Well, coaching is not judgment. You really blew it there, right? And it's not criticism. What were you thinking? That was horrible. What's wrong with you? Those are some of the worst things you could say to a child or to a friend and to a team member. And so I want you to catch yourself and make sure those things are wiped clean. If those types of things have happened in the past, time to wipe the slate clean and start over. What coaching is a way to engage someone and encourage someone. And it's mutual. So if Rebecca, the receptionist, my team member, I hear her on the phone and she's using some limiting terms that we've identified, and she hangs up the phone and doesn't get the result she wanted, whether that's scheduling the patient or preventing a cancellation or whatever it is, right? I have an obligation now to hold her accountable because I would want her to do the same to me. And so here's what I'm going to do when I coach. I'm going to ask permission. I'm going to say, hey, Rebecca, would it be okay if we talked about that phone call and just have a coaching conversation? She has every right to say, no, not right now. I'm frustrated. I'm not in a place. I say, all right, well, let's come back to it later. That's totally fine. But if she says, yeah, then number two, you simply ask some questions. Did you get the intended result you want? If you had to do it over again, would you say anything different? What about if you said this or didn't say that? Ask questions, right? That's a huge part of this process. And so when you create this conversation, you're creating accountability, and you say, I'd love it if you hear me saying similar things, that you'd call me on it and have a coaching conversation with me. You have to do this. Professional athletes watch film of themselves while their coaches are critiquing their every movement, right? Everyone's watching. So people who are fearful of being observed or watched, like if I go do an observation day, practice evaluation in an office, I'm writing notes. If people start getting nervous, just know that there's no judgment there. There's only ways to help each other improve. I'm your fan, you're each other's fans, right? And so eagles, this visual representation of being a 10 and a team of eagles is they just soar. They go higher and higher. We raise each other up, okay? So working together as a confident team means we're all 10s, and doing this means at any point, if we take a hit, we got somebody there to pick us up, lift us up, encourage us in the right direction. Also, celebrating your mistakes. You've heard that before. This is something that I think every team should do. Once a month, sit down, have a fun meeting where everyone goes around the room and shares their biggest mistake of the month. That means you learned from it already, and you're helping your team make sure they don't make the same mistake as well. So celebrating mistakes, it's phrased that way for a reason. It doesn't mean, hey, let's laugh at somebody who made a mistake. Let's sit around and talk about, what did I do? How do I improve upon it? And I don't want you guys to make the same mistake, so I'm sharing it with you. We used to have this meeting, and then we give a booby prize at the end, something silly, something fun, something goofy, nothing that really had value, just to get, booby prize, maybe a fake trophy, Have fun with this, because you've got to be willing to be vulnerable and look at yourself in a way that says making mistakes is okay to a certain level. Obviously, can't keep making mistakes over and over again, but you've got to have the ability, the mindset that doesn't affect your 10, and you can say, hey, I made this mistake, and here's what I did, and here's how I learned from it. I want you guys to learn from it too. Okay? You guys got it? All right, let's look at number 3, the permission statement. What is the permission statement? The permission statement is a verbal skill that has 2 parts to it. It's so important to remember that. So for my hygienists and my doctors, always has 2 parts. It has the part that helps us overcome our fear of rejection, and it has the part that helps the patient get a sense that you're not going to pressure them. You're not going to force them into doing something. They never want to be sold. So selling, right? Selling. How many of you, raise your hand, it's okay, how many of you don't like the word sell when it comes to dentistry? Usually when I'm in a room and presenting this, I'd say about 95% of the room raise their hand. So most of you probably raised your hand when I asked that question. And one of my mentors said, if you don't like the S word sell, get used to the B word broke. So how do we get around selling without feeling like there's this pressure we're applying? And I think the connotation is sold. Oh, you've been sold. There's a negative connotation of that. What does that mean? Right? Somebody who's been sold has been taken advantage of. They've been pressured into a situation, and we never want to do that. At the same time, when I'm in offices and I'm listening, what I hear all the time is, you need a crown. You need scaling and route planning. That's pressure selling right there. So if we don't like it, why do we do it that way? So I have a system of verbal skills to get us away from that and into a different category. So if you've heard any of the big gurus out there, Tony Robbins and all those guys, talk about push purchasing versus pull purchasing. If you've heard that before, push purchase would be a need, be synonymous with need, and pull purchase would be synonymous with want. So need, push, you need a crown. If you think about it, these are things that we spend most of our money on a daily basis, but we don't like to. right? So I need to get gasoline for my car. I need to go grocery shopping. I need to pay the bills. Or something breaks. I need a new appliance. I need to buy a new refrigerator. Great. It's things we don't typically like to do. And you relate dentistry to that. I need an extraction. I need a cleaning. I need a crown. Patients have a toothache. They think they need a crown, right? And they're saying it. They're calling up out of nowhere. And there's this other side, right? I think where we enjoy spending our money on, that would be a pull purchase, something that we want in our life. And you hear people say it all the time. I want to go out to what? Dinner. I want to go out to eat. Or how about this one? You could finish this one. I want to go on what? Vacation, holiday. I want to go. And people like to spend money here. You don't hear people wake up in the morning and they tell the story about, I really want a crown today. I want to go get an implant. That doesn't typically happen. There's a small percentage of people who say, I want to whiten my teeth. I want to change the way my smile looks. The aesthetic or elective services typically fall in this category. So you have this separation between need and want. How do we get our patients away from need? And I'm not saying we're going to get them all the way in the want category or they're going to want it naturally, but we're going to help them get to a place where we're talking about wants. And so we've got to avoid the word need. I think that's a 4-letter word to avoid. And we got to be closer to the want side in the pull category. And so we're going to get in that. You're going to hear me talk about this again when we talk about the preclinical examination before we ever even look in their teeth and their mouth and do an exam, okay? So part of that is the permission statement. So let's take a look at it. What does it look like? It's 2 parts. You could say, I'd like your permission to, or I'd like to be able to is how I prefer to do it. And you want to use a question. So part 1 is getting permission to tell them what you see during the exam, all right? Now, assistants, admin, we're going to do your permission statement too. This would be for perio-eval, periodic exam, comprehensive exam, emergency exam, whatever it is, okay? Doctor, hygienist, right? So I would say to Ricky Bobby, my patient, I'd say, Ricky Bobby, I want to be able to tell you everything I see that deserves your attention while we do this examination. Does that sound okay to you? Yes. Rewind, you can do it like this. Ricky Bobby, we're going to do an exam now. Or Ricky Bobby, we're going to evaluate the health of your gums now. And I want to be able to share with you anything I see that would deserve your attention. Are you okay with that? Question mark. Now, I'm not asking to do the exam. I'm telling them I'm doing the exam. Or assistants, if you're going to do x-rays, I'm going to take the necessary x-rays now. And I want to be able to share with you anything I see as we take these images. Okay? Intraoral photos, same thing. I'm going to be doing this. So don't ask permission to do what you have to do. Ask permission to tell them what you see during that process. Remember, it's about eliminating that fear of rejection. This was the old way. Look in the mouth, doing the exam. Okay, Becky, put down crown on number 2. You need a crown on number 2. There's no conversation. We just went straight past diagnosis, right, into recommendations. That's push sales. That's pushy sales. That's what we want to avoid, okay? So the patient says, yeah, of course you can do that. Now I have a relaxed feeling that I'm not going to be shot as the messenger anymore. And I do part 2. And I say, if we make a recommendation, just know this. You have the ability to make the final decision on how you like to proceed with any recommendations we may make. Does that sound fair to you? Keyword fair. Keyword if. Recommendations, right? There's no need in there. I'm not telling them, hey, once we tell you that you got to do a crown, there's nothing there. This is about them feeling relaxed now. If you've ever been on a car lot and the car salesman walks up to you and you're just looking, you're having a good time, they walk up behind you, hey, how are you doing? How can I help you? You ever get that feeling like, oh gosh, they're going to pressure me? There's just that feeling. And so if I were a car salesman, I'd walk up and say, hi, I'm Eric. Hey, I'm here for you. I know everything about these cars and I love to tell you about them. If you feel like you're interested in anything, you're welcome to ask me. And just know this, there's no pressure from me. I'm just here to help you. It's your decision. So let me know as soon as you have questions. I'll be right over here and I'll be happy to help you. Does that sound fair to you? That would be my car salesman permission statement. There'd be two parts to it. Okay. So I gave you homework last time, but I didn't really tell you how to do the homework. So you probably wrote some things down, that permission statement. And so right now, I'm going to give you a chance to push pause, to write this down, fix it, and then you're going to practice it. You're going to make sure it has two parts. You're going to practice it. If you're administrative, you're probably going to skip part one, right? You might just say, I understand you and doctor came up with a plan together. That's great. I'm going to go over all the financial options we have for you. And I want you to know you can choose whichever one works best for your budget. Does that sound fair to you? Something like that. So you're just doing part two. Okay. Now you're going to write it out. You're going to push pause, write it out, and then you're going to practice this. You're going to role play it. You're going to, if you're a dentist, you're going to just practice it as though you're the dentist. If you're admin, and so on. And then if you're the patient, I want you simply to listen and nod your head. It sounds good. And then I want you to offer coaching. We just worked on, being a confident team. And so I want you to offer coaching. So you ask permission. Hey, can I give you some pointers? Sure. What about changing this word? Question, right? What about changing this word? What if you tried this word? Okay. You don't have to use the word permission, but you can, right? There should be two question marks. Fair. That's a really good word to use. All right. So push pause, fix your permission statements, your homework, and practice it. Should take you 4 minutes. All right, go for it. I'll wait here. All right, so you practiced it. You got some coaching, and now it's time to start using it. Put it into action. Step 3 to overcoming that approval addiction and fear of rejection is using the permission statement. It should be something you use all the time. So doctors, every new patient exam, every periodic exam. Hygienists, every single periodontal evaluation. Admin, every single financial arrangement or treatment presentation, scheduling even. Assistance with your x-rays, emergency appointments, those sorts of things. Okay? All right. Everybody got it? Number 4, eliminating limiting terms. My favorite verbal skill of all time. Okay? So what are they and how do you get rid of them? Let's take a look at this. So there's 3 categories to limiting terms. Number 1, the category number 1 is where you minimize the condition. And I always joke, you never hear anybody say, you're a little bit pregnant. So if you can't put the word pregnant or pregnancy at the end of your phrasing, you're probably using a limiting term. And it's built around the condition, the problem that we're diagnosing. So I hear things like the tiny bit of bleeding. There's a little bit of bleeding, right? You have a small cavity. You have a pinhole cavity. These sorts of problems cost hundreds of dollars to fix. So if they're tiny, why isn't it a tiny dollar amount? It doesn't make any sense, right? So I want you to remember, if you're using these words, you just drop them. You have bleeding. There's bleeding in your gums. There's active infection, active decay. I love the word active. It's moving, it's creating, right? And so these are words that I want you listening for. You may be using them, but you don't know it. Category 2, filler words. These create doubt. So it's similar to the weatherman syndrome, slight chance of possible rain with increasing cloudiness as the day, it's like, what is it, right? What is it? Is it or is it not? It's all gray. There's no black or white. And so here are your filler words in dental office that create doubt. Those are 2 big ones. Those are my limiting terms that I constantly work on. Maybe might want to think about someday kind of considering the slight chance of possibly doing something like this. If you want to go home and think about it, possibly get back to us. Those sorts of things that you do create this gap, this foothold for doubt. And it's almost on a subconscious level where the patient just says, yeah, I'm not doing this. They said kind of, or it's just almost like ingrained subconsciously. And so these are words you're using, but you're not even aware of it. You're not cognizant. So we're going to talk about how to become aware of it. And the third one is technical jargon, the dental words that we use. We forget all the time that patients didn't go to dental school. They haven't worked in a dental office before. They have no idea what our terminology means. And so when we're trying to communicate to them and we say, the abfraction on the class 5 lingual has a buccal mesial furcation on the hemisection. These words mean nothing to them. They hear crown, that means something to them, right? That means something. When they hear the word crown, what do they think of right away? Money. They think of money. Also a limiting term because you've distracted them from the condition, the problem, and you've brought in selling, a cost, right? You're going to put something in their mind, right? In their mind that creates a reaction. So either you're improving their reaction to help with the sale of the condition, right? Or you're hurting yourself, right? This is key. Two things we're doing to move into the pull purchase category. Two things. Think about this, all right? There's two rules to follow to move them into the want category. People buy for their reasons, not your reasons. Write that down. People buy for their reasons, not your reasons. Just because you've got initials after your name doesn't mean they're going to do or believe what you say. Push purchasing doesn't work in these situations. People buy for their reasons, not your reasons. Number two, people don't buy a solution to a problem they don't perceive to have. Write this down. I'm going to say it again. People don't buy a solution. That's treatment. People don't buy a solution to a problem, condition, right? People don't buy a solution to a problem they don't perceive to have. This is why, admin team, you get a phone call, you call out and you do your courtesy call. We have you scheduled, with Dr. Smith coming up. Oh, I was just getting ready to what? Call you. That tooth's not even what? Bothering me. So I'm going to go ahead and what? Cancel that appointment. If they don't perceive there to be a problem, why would they spend thousands of dollars? Just because you told them to? Push purchasing. And so your technical jargon and your overwhelming of their brain and your limiting terms create the situation that really hurts our ability to sell. Now, let me talk about sell. What are we going to sell? What's the most important thing we could sell to the patient? Or let me reword that. What's the number one thing we want the patient to buy first? If you think about rule number 2 in selling, people don't buy a solution to a problem they don't perceive to have. What should we sell them first? Not treatment, not crowns, not even trust in us. There has to be a belief that there's a problem first. So I want them to buy the problem first. And you're going to hear me say that all the time. Number one thing we want them to buy is the problem. And if we're using limiting terms, now we've got a problem because they're not going to buy into a condition that they see as being a problem. They're going to walk right out the door. Yeah, he said there's a little bit of bleeding. It's a tiny cavity. I'm not worried about it right now. I'll wait till it bothers me. It's all backwards now. They don't know that leads to root canal and all these bigger problems. So here's how we're going to catch ourselves. We're going to create a flip chart, a dry erase board, a piece of paper on the table where you're sitting. Okay? And anytime you hear someone using a limiting term, any that we've talked about, you're going to write it down. You don't have to say who said it, but you got to write down the word. If you heard them use the word 4 times, write down the word 4 times. And that way, when we walk in the room and we see the limiting term chart, we say, oh my gosh, I wonder if I'm the one saying small or kind of. Kind of, that could be me. I got to work on that. I got to pay attention. And now you're going to become cognizant of it. You're going to have an ear tuned to it. You're in the right station. You're tuned in. And now you'll catch yourself. And if you catch yourself, that's okay. Give it a minute while you're talking to the patient and then come back to that same phrasing and just reword it without your limiting term. Okay? So another chance to push the pause button here. And I want you to write down any limiting terms you guys have heard and talk about it for a minute. Just spend 2 minutes sharing with each other what limiting terms you have. Okay? Push the pause button and go for it. All right. If you did that and you wrote down some words, you probably heard some similar things that I was using, right? The maybe, kind of, tiny, small, littles. We don't have an infection, right? You wouldn't say we are pregnant if you were diagnosing a pregnancy, right? Use that to help you. All right. Have some fun with it. Coach each other. Okay. So now it's time to assign leadership. And we'd love for people to volunteer for this. You may be voluntold if you don't volunteer, and everybody's got to be a part of something. So last meeting, we came up with morning huddle and asking for referrals reviews. And we also came up with someone who's going to help with our marketing plan and those sorts of things. So now I want to come up with a leader on our 4-step action plan to beating approval addiction. So somebody who knows 10, who knows a confident team, who knows permission statement, and who knows eliminate limiting terms. Maybe you're not using all those things all the time, but you're going to help hold us accountable to that. All right. So real quick, who is going to volunteer for this? Who we got? Could be 1 or 2 people. All right. Write down your leaders. Write them down. Know who they are. Okay. All right. Now, let's prepare for next meeting. Next meeting, we're going to talk about personality profiling. And so, if you have not taken the DISC profiler yet, I want you to go to this website. Okay, write this down: www.coreexcel.com. EXCEL. So it's COREEXCEL.com. Coreexcel.com. And just look right through there. You'll find the paper DISC profiles. They're like $25 a piece. Take those. Okay, there's instructions on how to do it. If you have questions about that, email me, ericyourcoach@charter.net. All right. I want you to take this and bring it to the next meeting you have with me in about a month, because you need a month to work on your 4 steps to beating approval addiction and fear of rejection. So within the next month, you'll have taken this DISC profile. What we're going to do with that is I'm going to help you understand all 3 levels of application when it comes to DISC. You'll know yourself because you'll have taken the DISC profile. I'm going to teach you how to quickly identify others with just asking yourself 2 questions about your patient or your team member. And then we're going to talk about adaptive behavior. How do you adjust to make the patient most comfortable to improve case acceptance? That's what this is about. All right. So we're going to talk about DISC and Harage. If you want, you can also Google the word Harage on the top of the screen. It's a Japanese word. You can also look that up if you like. All right. So 4 steps to beating approval addiction and fear of rejection. Now it's your turn to put it in action and go for it, and time to make it happen. All right. Awesome, you guys. Thank you for being so great. And I look forward to our next meeting. All right, you guys. Take care. Bye-bye.